Today we're going to talk about acute TMD, where you do something and your jaws get really sore in the joint area. So we're going to cover that real quick. So what we're talking about is acute discomfort. That's when your jaw joints and muscles in your jaws, just like any other joint or muscle, can be overworked. And that area becomes inflamed. And I saw a patient today, and it was acute onset, meaning she hadn't had any jaw pain, and all of a sudden, boom, it hit. The good news is that in most cases, these will respond very well to just rest, being gentle with the joints, and just protecting that area. So a lot of the times it's caused by if we yawn too big, or if we're trying to eat a really big burger, or trying to get the whole thing in our mouth and we hyperextend the joint, or there could be trauma, like somebody hits us in the jaw, or maybe we're in an auto accident. Those things can cause inflammation in the joint, and we can have acute pain. Now, remember, we talked about this in a previous episode that TMJ is the actual joint. TMD describes the symptoms such as jaw pain, limited opening, or clicking or popping in the jaw joints. So, the first thing to remember is just remain calm. Most of the time, these acute TMD episodes are kind of self limiting. Again, if we take care of that area, rest it, allow it to heal, it'll usually get better within a couple weeks, maybe a month. So just don't stress out about it. Try not to overuse that joint. And I tell my patients, I go, it's just like if you injured your knee. You would know that if you were touching your knee or walking and it was sore, tender in the joint area, that you probably just overdid it. And what you'd want to do is rest it and maybe put some ice on it initially and some heat on it after 48 hours or so. So same thing with the jaw joint. What we want to do is we want to let the joints rest, the muscles rest. So avoid hard, chewy or sticky foods, where you're going to be having to really crunch down or chew for a long time. Avoid extreme movements. Like if you yawn, try to limit the opening of your mouth when you're yawning. Don't yawn really big where you hyperextend the ligaments. Try not to talk too much and avoid gum chewing. Gum chewing is just working the joints and you want to let it rest. So if imagine your knee was inflamed and it was sore, you would try to rest it, not go out and run marathons. The other thing you can do is try to keep your teeth apart. Sometimes the way the peaks and valleys of the teeth come together, it forces our jaw joint and the muscles in a position where they don't really want to be. And so if you can rest your mouth so your teeth are slightly apart, you can keep your lips together, but just keep the teeth apart and maintain that relaxed jaw posture. That can help if the joints are really sore. Avoid leaning on your chin, which puts pressure on the jaw joints. And some people sleep on their side or stomach, and they have to turn the head to the side, and that kind of extends or pushes the jaw out towards the side also. And again, it just makes that joint more irritated. And the patient I saw this morning, it could be related because she's pregnant. So when we're going through pregnancies, our ligaments kind of loosen up, and that's just so the baby can come down the birth canal. So the same thing can happen in the ligaments in the jaw joint area. It's easier to hyperextend that area because the ligaments are more prone to that. Home care is a great place to start. The first 48 hours, you can put ice compresses there just to minimize the inflammation. But then once that area has been like that for a few days, it's better to switch over to moist heat. So I recommend patients just take some towels and moisten them and then warm them up and just keep those warm compresses on the muscle and the joint areas to improve the circulation. You can gently massage the joint area. Usually it's right around the cheek and the cheekbone area closest to the ear. Massage that area and then you can actually start to stretch gently. Just open as wide as you can comfortably. And sometimes you can take your fingers, and if you can only get two fingers in, again, side by side, so vertically they're opening the jaw up. You start there and hold it there, and then try to get to three fingers and more. And just gently start to stretch the muscles in the joint. You can, for short-term use, maybe take some non-steroidal anti-inflammatories, so like ibuprofen, 400 or 600 milligrams. Take that perhaps 4 times a day. It'll help reduce the inflammation and the pain. Muscle relaxants can be indicated if the doctor you're seeing thinks it could be a muscle. A lot of times I try to avoid that because it affects your whole body, and then try to avoid narcotics or really strong medications. Another thing to do is just relax. Try to avoid stress or contain your stress so that you're not clenching down or bruxing. Clenching is like clenching, holding your teeth together nice and tight, and bruxing is when you grind your teeth side to side. Just try to relax. Be mindful of your situation. Again, we talked about gently stretch the jaw, joint muscles, and try to avoid clenching down or holding your jaw tensely. Sometimes some of us find ourselves doing that when we're driving. If you do all that and the joints still feel tight, then sometimes what we'll do is we'll reevaluate you in a week or two, see if things are getting better. If it's not, then we might consider TENS therapy, which is transcutaneous electrical neurostimulation of the muscles to help them relax. Maybe physical therapy, maybe trigger point injections. And then we might actually do some imaging of the jaw areas to see how the joint actually looks. Sometimes the joint's not in the right position. Sometimes the joints can be arthritic, and that can also contribute to the discomfort. And then we sometimes will use some type of we call an orthotic device. This can be a soft or hard occlusal appliance that helps to reduce the pressure on the joints, and it helps to reduce the muscle strain. So there are other treatments that we can use, but I always recommend patients start with the easy home care. Just take it easy, take some pain meds, moist heat, soft diet, and see how things go. Again, Miyazaki Dental, where advanced science meets the compassionate care. Take care.